Hey, how's it going? My name's Mikey Dillon. Today I'm going to be talking about women and cancer and why it's such an important issue when we think about women's health. Cancer is one of the biggest health problems for women around the world. Some of the most common types are breast cancer, cervical cancer, and ovarian cancer. A big reason this topic matters is because a lot of these cancers can actually be caught early or even prevented, but only if women have access to the right care and information. The problem is not everyone has that same access. Things like money, where you live, your background, and even your education can really affect whether you're able to get regular checkups or screenings. For example, some women don't have easy access to things like mammograms or pap tests, especially if they live in rural areas or don't have health insurance. So their cancer might not be found until it's more advanced, which makes it a lot harder to treat. Also, sometimes it's not just about access, it's about awareness. Some people might not know when they're supposed to get screened, or they might not realize how important it is. And if no one is talking about it in their community, it can get pushed aside. Another thing that stood out to me is that cancer doesn't just affect your body. It can also affect your mental and emotional health in a big way. Getting diagnosed with cancer can be really overwhelming. It can bring fear, anxiety, and a lot of stress, not just for the person going through it, but also their family. There's also the financial side. Treatment can be expensive, and that can add even more pressure. Something else I think is really important is how early detection can make a huge difference. When cancer is found early, there are usually more treatment options and a better chance of recovery. That's why regular screenings and checkups are so important. But again, this goes back to access. If people can't get those screenings, then they're already at a disadvantage. I also think it's important to talk about how culture and personal experiences can affect whether someone seeks care. In some communities, there's stigma around cancer, or people might be scared to go to the doctor because they do not want to hear bad news. Others might not trust the healthcare system, especially if they've had negative experiences in the past. All of this can lead to delays in diagnoses and treatments. Another thing that doesn't get talked about enough is support during and after treatment. Women going through cancer often need more than just medical care. They need emotional support, community, and resources to help them manage everything that comes with it. That could be support groups, counseling, or even having people around them who understand what they're going through. One idea that could really help is doing more community outreach and education, especially in areas where people don't have as many resources. Things like free screening events, mobile clinics, or even using social media to spread awareness could make a huge difference. I also think it's important that healthcare providers communicate in a way that's clear and easy to understand, so people don't feel confused or overwhelmed. Another strategy could be making healthcare more affordable and accessible, because even if people know they need care, cost can still be a huge barrier. Expanding programs that cover screenings or treatment could really help close that gap. One question that I want to ask is, how can we make sure all women, no matter their situation, feel comfortable and able to get the care they need? Because right now there are still big gaps, and that's something we should still be thinking about, not just in healthcare, but as a society. Overall, women and cancer is such an important issue because it affects not just individuals, but families and entire communities. If we focus more on early detection, education, support, and making care easier to access, we could really improve outcomes for a lot of women. Thank you for listening, and I'm really interested to hear what you guys have to say. Thank you.